right, so people will continue to connect. That's fine. I do want to honor your time. And so thank you all for joining. Thank you for being on time. My name is Laura Liz Morales Silva. I'm the manager of capacity building at FPWA. I'm joined here by my colleague, Aria Linatz. I'll let her introduce herself.
Good morning, everybody. My name is Adia, and I'm the Director of Programs here at FPWA. Work closely with Laura Liz, and again, welcome, and we're very excited to have you here.
So this is our second fall offering training. We're really excited to get this fall series started. And so our last training, which was September 15th, on understanding toxic stress and trauma, is available on demand on our website. We will send out a link to that if you weren't able to catch it. And if you did and just want to rewatch it, feel free to register to watch the on-demand version. Today, we'll be talking about trauma-informed service delivery. So welcome, everybody. So we do encourage participation. I know it's a webinar, so our options are a little limited, but please use the Q&A or the chat function for questions, comments, concerns, anything like that. We will do our best to monitor the Q&A throughout the session. Yes, this session will be recorded and it will be posted on our FPWA website. So feel free to just listen. You don't have to take notes. And you will be receiving a follow-up email with the slides, the resources, and a short post survey. So please take those 2 minutes to complete the survey. It really, really helps. And also, just please take care. We will be discussing topics around trauma, and we just want you to take care of yourself. If you need to step away, if you need to put us on mute for a while, that's perfectly fine.
All right, so we'll start with just a very brief overview of who we are at FPWA. So first, FPWA is an anti-poverty policy and advocacy organization. We have a membership network of over 170 human services and faith-based organizations. In our work, we promote the social and economic well-being of both individuals and communities by advocating for just public policies and strengthening human service organizations. And so then, what do we mean by human service organizations and nonprofits? What actually are we doing? So FPWA supports nonprofit and faith-based organizations by building their capacity to use a trauma-informed and people-centered approach to service delivery, organizational effectiveness, and civic engagement. And based on the title of this session, you guessed it, we're focusing on the service delivery part today, how we can do that in a trauma-informed way. So for some of you, a trauma-informed approach may be new, not for everyone, but we wanted to just take a moment to give sort of an overview on one slide about why the focus on trauma-informed care and trauma responsiveness. So first there, we know that nonprofit and faith-based organizations play an integral role in supporting the needs of individuals and communities. And we know that you've been called on often, especially in the last couple of years, to really fill in the gaps as well, where sometimes governments and systems cannot. So folks are coming to you with a variety of needs, and a lot of times these needs may stem from generational, interpersonal, systemic, and/or community trauma. And so we know too that when people are coming with needs that are sort of rooted in trauma or re-traumatization and perpetuating that type of trauma, that organizations will best serve those participants, those program participants or clients, by addressing both the root causes and manifestations of trauma. And so to help you do that, to help build your understanding and your ability to address the trauma, we're offering a core set of trainings this fall and hopefully every fall that's focused on trauma-informed practices. And ultimately, we believe that a trauma-informed approach will result in an effective and impactful human services sector that is best positioned to serve the communities and really interrupt the cycle of trauma and poverty.
Great, thank you for that. So before we get started, we just want to get a quick sense of who here attended our previous training. So I'm just going to launch the poll. Just let us know if you were here or not, just so we can get a better sense. And you should be seeing the poll now. Did you attend our September 15th webinar, Understanding Toxic Stress and Trauma? Yes, no, or don't remember. Just going to give everyone like a few more seconds. We're almost at 100%. Thank you. All right. Excellent. Well, thank you so much, everyone. All right. So a lot of new people on the webinar today. Great. Exciting. So we do have a short kind of a brief overview of what we discussed on the 15th. So we'll be going over that before we get into the nitty-gritty of today's topic. So thank you everyone for participating in that. So today we'll pick up where we left off in the first session, which means a quick review of definitions to start. Basically, what is trauma and what do we mean by trauma-informed approach? We'll then outline the essential elements of a trauma-informed approach. There's no one right way, we know this, to implement a trauma-informed approach, but you'll see slightly different language depending on the setting. But there are some essential elements, right, that we can all agree on and that run across all of them. So we'll be sure to highlight those for you. And finally, we'll spend the majority of the session digging into some real examples of trauma-informed service delivery. Often we have a gap between what we heard in a webinar or in a training, and then how do we apply that in real life? So that's what we're hoping to bridge today, give you some real simple examples of what you can say, what you can do. So we've put together 10 strategies for trauma-informed approach and giving you examples of what it looks like in practice. And next, then we'll start with a brief review of the definition of trauma and trauma-informed service delivery.
Excellent. So it looked like about 72% of you were not on the first call, so welcome, and we're happy you've joined us this time. So we'll briefly review what we covered, but like Lily said, we want to spend the bulk of it on really talking about what you can do and what you can say to be trauma-informed. So first, there is no one definition of trauma, but there are some essential elements that you see throughout various definitions. So for our purposes today, we're looking at the SAMHSA definition, which is individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening and has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. And so in practice, trauma is often thought of as sort of that event or series of events. It's really overwhelming to a person's ability to cope. And so some of those traumatic experiences include, but are obviously not limited to things such as violence, neglect, homelessness, substance abuse, or untreated mental health issues. And those are represented in this image here as the branches, the things that we may see, we may interact with when a client or program participant comes in. It's sort of the quote, presenting issue. But we also want to acknowledge that there are traumatic environments and systems that are often actually the root cause of some of those quote branches and what might be the presenting issue, that they may cause or at least perpetuate the trauma for individuals, families, and communities. And these can certainly include a broader set of experiences that are rooted in systemic oppression and interactions with oftentimes racist systems. So for example, racism, xenophobia, homophobia, unequal access to quality healthcare, housing, or education, employment discrimination and wage gaps, and certainly involvement with systems such as the justice system or child welfare, foster care, things like that. So in order to effectively serve and support the individuals or families that are coming into, coming through our metaphorical or literal doors at our nonprofits, we want to really understand both the branches, so to speak, as well as the roots. And in terms of service delivery, direct service, We're talking more about sort of the branch, again, the presenting issues, the behavioral manifestations, what someone's coming to you for help with. And that's what we're going to be focusing in on today. But just want to make sure that we say that if your organization has a policy and advocacy, or more systemic focus, looking at the root causes of trauma is a way to help mitigate some of the experiences as well. So we want to look at both what's above the surface and below the surface.
Great. So as a review from our last session, here's the definition of a trauma-informed organization, also from SAMHSA. So a trauma-informed organization is a program, organization, or system that realizes the widespread impact of trauma, understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. So to review some of the concepts from our Understanding Toxic Stress and Trauma training, we want to share a clip from the video, What is Trauma-Informed Care?, published by the Center for Healthcare Strategies. So I'm just going to play that now.
Hi, I'm Dr. Cruz. Early in my career, I noticed a pattern with some of my patients. They often had multiple health issues, were uneasy during office visits, and frequently visited the emergency department. But worst of all, they never got better despite multiple visits. Then I realized something. From an early age, many of my patients were exposed to trauma and adverse childhood experiences, or ACEs. This includes emotional, sexual, or physical abuse, violence, neglect, discrimination, poverty, and other adverse events. ACEs are more common in the US than you'd think. In fact, 60% of US adults have one ACE, 25% have 3 or more ACEs, and 16% have 4 or more. ACEs occur in all socioeconomic groups, but are more common in low-income and minority populations. For young children, repeated exposure to trauma can impact brain development and literally rewire the brain's response to stress. So as they grow up, many struggle with issues related to emotional regulation, like depression, anxiety, or substance use disorders. Trauma survivors are also more often at risk for chronic diseases, behavioral health problems, and even suicide. Knowing all this, I began to rethink my approach to care. Instead of asking patients, "What's wrong with you?" I ask, "What happened to you?" Recognizing that life experiences are often a root cause of poor health is integral to improving patient care. Trauma-informed care has helped me take these experiences into account, providing greater insight into my patients' needs and how to address them.
So to build on what we heard in that video there, we're showing another sort of popular image. Again, you see different varieties of it, but it's the iceberg model is what it's called. And again, it's looking at what are we seeing right in front of us versus what might be happening underneath the surface and the root of the issue and what we want to address. So above the surface, so to speak, you may be witnessing or experiencing challenging or harmful behavior, dangerous behaviors. So for example, self-harm, extreme anger, running away. And the problem is oftentimes those behaviors are met with punitive consequences to try to stop the behavior. But really all that's doing is further isolating a person and may even re-traumatize them. So when we're talking about being trauma-informed and trauma-informed service delivery, we're trying to understand those behaviors and reactions and really see them as, quote, normal reactions to, quote, abnormal situations to the trauma. They are normal trauma responses. And so we want to work to put into place positive protective factors that aim to address what's happening under the surface, and hopefully to lessen the risk or at least the impact of the trauma or adverse experiences. So again, the outward facing reactions and behaviors are natural coping mechanisms. They may be unhealthy, but they're natural, and we don't want to punish or have punitive consequences there. And so when we're talking about specific strategies, practices, actions that we can all take to address and begin to mitigate the negative effects of trauma, what we're doing is trying to get at those feelings of feeling unsafe, worthless, and alone, rejected. That's what we're trying to either eliminate or at least back away from, and help people sort of be able to cope in a healthy way and see themselves with confidence and resilience. So we talked as well about a few positive protective factors. So just want to quickly define what we mean by that. You'll hear that phrase throughout today's session. So a few quick examples of positive protective factors are stable employment, adequate housing, access to healthcare, high quality education, safe and affordable childcare, and connection to caring adults, often outside of your family, that can help and support you, and maybe even serve as a role model or a mentor. So all of these are examples that are happening throughout your organizations and what we're working towards. So we commend you for that. And hopefully we'll have some more specific strategies as we go through today that will help you to do this work in a trauma-informed way.
Great. So we want to take a moment just to check in with everyone before we move into our final review slide. Let's take a moment and just answer the following poll question. Does this resonate with you? Considering what we've discussed so far about trauma, do you think that some of the challenging interactions you might have had in the past with participants were actually trauma responses? And here we're really thinking about that iceberg model, right? Those behavioral manifestations and then the trauma underneath. Do you think that some of those interactions with challenging participants might have actually been trauma responses? And let us know what you think. All right, so I'm just going to give another few seconds. We are almost at full participation. Thank you again. Let's see. Great. Thank you, everyone. So it's pretty split, but both are yes. So yes, this happens a lot, happens frequently, and yes, at least with some participants. And that's, that is one of the realities that we face on the front lines. And so I think part of the main goal that we have today is to help us all reframe, right, some of those behaviors and understand what might be the underlying cause. So thank you everyone for that. So one last review slide, we want to highlight the distinction today between trauma therapy and a trauma-informed approach, right? So trauma therapy is incredibly important. It's part of a person's recovery and healing from a traumatic experience. Trauma therapy includes licensed clinical mental health professionals. It's an intervention that occurs in a therapist or counselor's office. It's usually one-on-one, or it can be in a small group session. The focus is really on treating the symptoms of trauma like depression, anxiety disorders, PTSD. But we're not talking about trauma therapy today. Instead, we are very intentionally talking about trauma responsiveness and a trauma-informed approach. And that's basically and that's important for us because you don't need to be a mental health professional to use this approach. So it's something that is accessible to everyone, to every staff person, every volunteer, every intern at your organization, regardless of their role. So a trauma-informed approach includes thinking and responding differently to a person's reactions and behaviors. That's the exercise that we just did right now. Practices that can be used by anyone in any setting. Again, you do not need to be a mental health professional to be trauma-informed. It involves considering what happened to you rather than what's wrong with you, right? That example that we saw in the video, the reframing, and moving away from punitive consequences and toward next steps that aim to build coping skills and promote healing. Again, those protective factors that we mentioned earlier. So next, we'll move into the essential elements of a trauma-informed approach.
Thank you. So there's two sort of primary categories that a trauma responsive or trauma informed approach fall into. The first one is creating a safe and supportive environment, and the second there is fostering trusting and meaningful relationships. So to discuss a little bit of the first one, the creating a safe and supportive environment, this is really important because it helps to address the sort of quote flooded nervous system or feelings of helplessness and hopelessness that are often associated with trauma. And when we're talking about a safe and supportive environment, we're referring to physical space, but also emotional space. I know physical space is sort of the most obvious starting point, and we will talk about that more, but keeping in mind that social and emotional space as well. And so, for example, when we're talking about the physical space, if you're working with someone who has recently left a dangerous housing situation, maybe because of domestic violence or drug abuse or something similar, it's incredibly important to consider what they're walking into when they walk through your doors. Thinking about what does your office look like, your conference room, your rec center, your church. What does it look like? What does it feel like? Is it well lit and comfortable? Are they greeted when they walk in? That's a really important one. Or does it feel more like a sterile waiting room that might sort of trigger someone? And we'll get much more into that later. And when we're talking about considering emotional safety, think about somebody who has tried to tell their story or experience and been met with judgment or rejection in the past. So you want to make sure that you are creating an environment where a person knows that they can share their truth and their story and be both believed and supported. The second category is fostering trusting and meaningful relationships. And we know that traumatic experiences can make a person feel ashamed or alone. They may blame themselves, especially we see that in children, right? If I didn't do this, this wouldn't have happened, which is not true. And so we want to counter that. And one way to do that is to really foster meaningful relationships, whether it's through a mentor, it could even just be someone that you're seeing for a very brief amount of time, but it's the consistency and frequency there. And also something just to point out here, and we'll talk about this more, is keeping in mind that this is not always an easy process. And oftentimes the individuals who are most in need of a close and meaningful relationship are the ones who sort of push it away. And this can be a subconscious sort of test of commitment. And an example I use there and that I have seen in previous work is that, a young person who has experienced the foster care system and was told by the family, we're here for you, we're going to get through this together. And then the challenges arise and the foster family decides this isn't actually a fit and that child is moved to a different family. And what they feel is rejection and isolation. And so they may not believe it, especially adults, when they say, I'm here for you. And so just keeping that in mind that none of this is necessarily easy, but it's incredibly important and it's the foundation. So we'll get more into that as we go through the examples. And just a couple more notes here on essential elements. Laura Lisa already said this, but we'll keep reiterating it, that being trauma informed and trauma responsive is primarily a shift in mind frame and approach. And we say that again here because we want folks to know this is not a new program or a new initiative. It can be woven in and used in what you already have. And also, most of the strategies are free. And they can be effectively implemented by everyone at your organization, regardless of role or level. So we are including social workers and mental health professionals, but we are also including all staff in any role. So this is really something that is accessible to all.
So now we'll move on to the primary goal of today, which is providing examples of what trauma-informed service delivery actually looks like. And as a reminder, if you have questions, please feel free to enter them in the Q&A. I see that we have 2 already, so we'll do our best to answer those as we go along. And as we mentioned previously, there isn't one right way to use a trauma-informed approach, but we thought it would be helpful to start moving from ideas and generalities to some specifics. So for today, we'll cover 10 strategies that you can use in your service delivery that will both create a safe and supportive environment and cultivate trusting and meaningful relationships. So here are 10 strategies that we'll dig into. Number 1, ensure that your physical space feels safe and inviting. 2, prepare for meetings. 3, set clear expectations and continuously check in on them. 4, focus on what happened to you rather than what's wrong with you. 5, actively listen. 6, demonstrate empathy. 7, take a strengths-based approach to conversations and/or problem solving. 8, focus on partnership and minimize any power differential, whether it's real or perceived. 9, offer predictability, be reliable and consistent. And 10, be mindful about closing the case or relationship. And before we go any further, we do want to let you know that this is all written down. All of the examples that we provide are in a 2-page resource that we've developed called Trauma-Informed Service Delivery, Strategies and Actions for Working with Individuals. You'll all get a copy of that. So no need to go crazy taking notes. All of the examples are pulled from that sheet. And in the sheet, there are specific examples of what you can do and then what you can say. So as we go through the next few slides, again, don't worry too much about taking notes. You will be getting a copy of this sheet after the training.
Okay, so strategy number 1 is space. And we started talking about this briefly a few slides ago. But in this case, we're going to zero in on your physical space and making sure that it feels safe and inviting. So again, for individuals who may be coming to you from spaces that feel unsafe or even just cold and institutional, entering a space that immediately feels calm and inviting can make a very big difference. It signals safety, but also dignity and respect for those coming to you. And so as we mentioned in our previous training 2 weeks ago, that understanding toxic stress and trauma, sort of seemingly common or non-threatening actions and situations may be interpreted as a threat to someone whose nervous system is on sort of that high alert or that hypervigilance because of trauma. And so they may be triggered by things like fluorescent lighting, loud noise, or again, that institutional, that sterile waiting room. And so a way that we can mitigate that or lessen it at least is to create a space that is calming. And so looking at the few examples here, the first is a waiting room in a health center. And so just pointing out the use of lamps instead of overhead lights. There's calm, you can't really see in this picture, but it's like a very light grayish blue color on the walls, which can be calming, some art. And on the table there, again, they're too small to see, but the reading material there really speaks to a wide variety of sexual orientations and gender identities and feels inclusive in terms of what is presented. The second example there is what we call a calm down corner, maybe a peace corner, a coping corner. You hear different things. And this one is in a childcare center, but certainly can make them for older children and youth and adults as well. And so this is a space where someone can go when they are starting to feel triggered or dysregulated. Having sensory items such as koosh balls, fidget spinners, bean bags are great. It's a real sensory kind of experience to sit in a bean bag and maybe feel held. Again, you see some lights there, holiday lights or anything that you can string that sort of dims it and helps to calm. And I want to pause here for a second because just sort of pointing out sort of a scenario that we see a lot. And so imagine that a young person in your program or in maybe if you're working at a daycare childcare in your classroom, aggressively kicks over a chair. And the teacher or leader, program leader says, what's wrong with you? And calls some kind of safety agent to come in to deal with this quote behavior infraction. And we're heading towards this punitive consequence right now. But what's actually happened is the child had a big emotion and was sort of sent away to deal with it alone. And they might become overwhelmed with their nervous system and the feelings of shame and isolation that are frequently associated with trauma are only reinforced. But imagine instead a situation where the teacher or program leader notices that the child is becoming agitated for whatever the reason is. And before things escalate and that punitive consequence comes into play, the child is allowed to go to a calm down corner like this. Same with an adult, right? By the way, I need to step out. Is there a place where, a health room or a wellness room where I can go and take a breath? Having that moment can really serve as a supportive option and allow folks to develop those healthy coping skills. And finally, there's a picture here. This is entering into like a conference center. and the sign right in the front that says, "We can serve you in your language." And each of those is a different language and telling people what rooms they can go in to see a translator or an interpreter for services. And so right away, a sign like this signals we want you here rather than you're a problem or we can't help you, right? So just thinking of the little things you can do. And again, just reiterating why this matters. So for people who are hypervigilant or easily triggered as a result of traumatic experiences, a physical space that is calm, inviting, and inclusive can be a really powerful de-escalation tool. And it also creates the opportunity to learn or build healthy coping skills.
And I do want to mention, oftentimes we don't have any control over how our office looks like those fluorescent lights. I hate them. They're always there. But you do have control over whatever little space you have where you're meeting with participants. So even if you're in a cubicle, maybe you have your own office, there are a few things that you can do in that tiny space to make that feel a little bit safer, a little bit calmer for your participants, even if, you know, the larger organization is still not totally on board. So having those different resources and available in different materials, having posters or artwork that is reflective of the community that you're serving, those small little details like lamps or plants or anything like that can be helpful. Having, I don't know, like those sensory objects or anything like that would just be an extra step in the right direction. So just want to point that out. Even your small space can make a difference in that person's day. So strategy number 2 is preparation, and specifically preparing for meetings. So this goes in both directions. It means preparing yourself for a meeting with a client or program participant, as well as preparing your client or participant when you refer them out, right, for a meeting or appointment. So first, for example, before a meeting with a new individual or a family, try to familiarize yourself with the case, their names, their preferred pronouns, and the reason for their visit. We know you're probably overwhelmed with the amount of people that you see, so it'll be impossible for you to remember everyone's name. But if you have 5 minutes before a meeting, it really makes a difference when you greet someone with their name and you know why they're already there, right? It can be re-traumatizing for some people or triggering to tell their story over and over again. It might even be frustrating if they've seen you a few times and they feel like you don't remember them at all after they've shared such personal or traumatic experiences with you. So preparing ahead of time, it really helps to minimize that. And on the flip side, it also means helping a client or participant prepare for an external meeting or appointment. So for example, when you arrive, you'll need to show a form of ID. There'll be a metal detector. You'll ask to meet with Cynthia on the 3rd floor. There'll be police there in uniform in the waiting area, and Cynthia can call an interpreter for you. So all of those little bits of information help provide a sense of control for your client or participant in a world that's usually completely out of their control. Why this matters, again, there's often a lack of control associated with traumatic events and circumstances. And as a result, a person's body may constantly be in fight or flight mode. Understanding who they'll be talking to, what they'll be talking about, all of that can help restore that sense of control and help the nervous system to return to a resting state.
Exactly. I just wanted to reiterate what Laura Lee said is we're not saying that in order to be trauma informed, you must do all these things all the time. We're giving you a variety of strategies and building on and, you know, really focusing on what you can do, what your team can do, what your organization can do. So strategy number 3 is very closely related to preparation, and that is expectations, and specifically setting clear expectations and then continuously checking in about them. And so a big part of building trust, going back to one of the essential elements there, is to have clear expectations from the start. People receiving services from your organization may be interacting with multiple other systems at the same time. They may be meeting with, for example, housing attorneys, immigration attorneys, counselors, education specialists, etc. Sometimes in the same building, sometimes not, sometimes in the same day. And it can be really stressful to understand and keep track of who and what is going on at all times. It can be confusing and extremely overwhelming, especially if they have not been included or consulted on treatment plans or referrals. So, oh, sorry, I think I clicked this the wrong way. Will you click one more time, Marlies, before we get into why it matters? There we go. So just as an example about setting expectations, something like, my name is Maggie, I'm a paralegal here. I won't be giving you legal advice during this conversation, but the information you share will help me draft your petition. I can be reached via email and I will respond within 48 hours. So again, we know that in reality, no one puts that much information in one sentence, but as an example, letting people know how they can reach you, how quick they can expect a response, what your job is, what your job isn't, that really helps, again, regain that control. So going down to the why it matters part, setting clear expectations with participants about what they can expect from you, what you can expect from them, and propose services and treatment plans, who will provide services, and how care will be provided is essential to building and maintaining trust.
All right, so I'm just going to walk you through a potential example, right? The strategies of preparation and setting expectations, they're very closely aligned. And again, they can make a huge difference in someone's experience with your organization. So we're going to run through a scenario now that illustrates what can happen without a trauma-informed approach. And then we'll run through the same scenario again with a trauma-informed approach, just to see how different the outcome can be. So picture this. Lorna is an adult education counselor from New Day. Maria is an undocumented immigrant from Mexico. She has 3 children, and although she speaks some Spanish, her main language is Mixtec. One day, Maria confides in Lorna that learning English has always brought up a lot of mixed feelings and emotions for her. It was difficult for her to successfully complete English classes in the past because her abusive ex-partner used her lack of English proficiency as a control tactic and would constantly say that no one would ever believe or understand her. He'd also make it impossible for Maria to complete her coursework. So Maria is now in this new English class. She's doing well. And so she's confiding in Lorna why she hasn't been successful in the past. Lorna wants to help Maria and refers her to the center for further support and services. So in scenario number 1, that's not trauma-informed, Lorna refers Maria to the center, but because she's not a case manager, she doesn't really feel it's her place to get too involved. And so she doesn't really discuss anything further with Maria, just tells her, you should go to the center. However, because Lorna didn't prepare Maria or set clear expectations, Maria's kind of unsure of what she's walking into. She had planned to arrive early, but had a hard time finding the center because it's actually a small office in a much larger building and signage is minimal. When Maria does finally enter the building, she immediately spots 2 armed guards and a large metal detector, which makes her nervous. When she reaches the receptionist, she's asked for her ID. Now, Lorna didn't really tell Maria that they would be asking her for an ID, so this throws Maria into a state of panic. She only has an expired passport, which she didn't bring. Will she be able to meet with someone today? Finally, Maria does make her way upstairs to meet Miss Sanchez. Miss Sanchez starts the conversation by asking Maria to tell her why she's there. But all Maria can think about is that there are people walking by and they can see her. They're in a cubicle in the middle of the office. They will probably be able to hear everything she says. Didn't Lorna tell Miss Sanchez why she was coming? Would she have to tell her story all over again? Now, instead of feeling safe and supported, Maria's feeling tense and afraid, which takes her immediately back to memories of feeling tense and afraid at the hands of her former partner. As she's telling her story, Miss Sanchez interrupts because she realized Spanish is not her first language. Maria will have to come back in 2 weeks when an interpreter is available. Maria leaves frustrated and confused, and she's not sure whether she'll be able to take another day off from work to come to the center. So this might sound familiar to some of you who've referred clients or participants in the past. They might come back to you and say, I wasn't able to meet with anyone. They didn't have an interpreter. I didn't know what I was walking into. They were rude, et cetera, et cetera. So now let's look at how that same situation could have gone much better using the trauma-informed strategies of preparation and setting expectations. So quickly, same basics of the story. Lorna is an adult education counselor at New Day. She's referring her client Maria to the center for additional services. This time though, Lorna takes a trauma-informed approach to the referral. First, she asks Maria if she thinks it would be helpful to connect her to services at the center. Maria says yes, and already is feeling a sense of control over her own situation and next steps. Then Lorna decides to call ahead and make sure the information she has on the center is correct and up to date. And she also manages to schedule an appointment for Maria. So Lorna then shows Maria a picture of the building during their last class together and takes an extra step and provides her with a printout of the Google Maps directions. Maria arrives at the center on time and without incident. Then Lorna had already told Maria she would have to show an ID when she arrived. She told her she would go through metal detectors, and she had told her to check in upstairs. So Maria is able to remain calm and in control as she makes her way through the building to her appointment. Because Lorna had spoken with Ms. Sanchez before the meeting, Ms. Sanchez was prepared for Maria, and she was able to reserve a conference room. It was small, but private. Lorna also made sure that Ms. Sanchez had secured an interpreter for their session. Ms. Sanchez explained that after the initial intake, she would call Maria back within 2 weeks and let her know about next steps. So in this trauma-informed scenario, Maria feels safe, supported, knowledgeable, and most importantly, in control of her situation. These were two very different experiences. One was confusing, frustrating, and potentially triggering. The other, although still potentially difficult for Maria, was manageable and certainly less stressful. The things that made the difference were small strategies that anyone can implement.
Moving on to strategy number 4, which is shift your mind frame. And what we mean by that is focus on what happened to you rather than what's wrong with you. You've already heard that phrase a couple of times and you'll continue to hear it, but it's incredibly important to keep going back to it and really training ourselves to at least consider, if not actually ask, what happened to you. And so we really want to keep in mind a person's trauma history. And even if we don't know, or we don't know the details of their experience, it's still beneficial to consider that question, or a version of that question. And you don't need to do a formal trauma screening. In fact, we recommend that you don't, unless you are a social worker or a therapist, but really just asking everyone sort of what brought you here today. And before reacting or responding to an individual, really training yourself and practicing to consider the story or reason behind their behavior. Just a reminder that very rarely is a person trying to make your day hard, even though we do acknowledge that it might feel like that sometimes. We're going to play a short video now, so I will mute for a moment so we can hear it.
I experienced patients that were behaving in ways that were really stressful, cursing, yelling, really heightened emotions at the front desk, in my office, breakdowns. We might naturally ask ourselves, what is wrong with that person? Trauma-informed care is really about saying, what happened? Why would a person behave that way? Rather than what's wrong. We're viewing people more as a whole person that has had life experiences rather than a caricature of their behavioral reactions. We start to then make another shift from being stressed out from this person to then being more empathetic. We then shift our behavior. So if I look at someone and I say something's wrong with them, then that might give me permission to behave in ways that are not helpful. And so when I say what happened, then I am now mentally thinking, how can I help this person? Is there something that I can do that can make their experience better?
So as the video was saying, that reactions don't come out of thin air. Oversized or inappropriate or puzzling behaviors are all sort of quote normal reactions to abnormal situations. So really taking the time to consider what happened to you helps to put those reactions into perspective, and can help you respond in a way that avoids escalation, or re-traumatization. And I just want to, before we move on to the next strategy, acknowledge
Right.
someone had a really good point that they just made in the Q&A that I want to read out, that remembering that what is re-traumatizing for some may actually be what feels safe for others. So in the example of metal detectors and security guards or police officers, which is true, right? Not everyone's having the same experience, absolutely. And so that goes back to, it's really about the preparation and the setting expectations of what someone is walking into. And so that they can prepare, whether that helps them feel safe or they might be triggered by it, knowing that's there is really the point that we want to take away. So thank you for that comment. That was a helpful one.
Great. So strategy number 5 is actively listen. Even when your role is not that of a counselor or social worker, you can still create an environment in which the other person feels heard, seen, believed, and understood. You can start by being a more active listener by being present and focusing. This might mean turning your phone face down, putting it away, or leaving it outside of the meeting area. Also, being mindful of your facial expressions, your body language, and your reactions to what is being shared with you both in person or virtually. So avoiding crossing your arms, staring at your computer, doodling, watching the clock, etc. And if you need to take notes while the person is talking, just letting them know that that's what you're doing goes a long way. You can say something like, I'm going to be taking notes. So if I'm looking down during our conversation, just please know that I'm listening and writing. Again, try not to interrupt, correct, or argue. Instead, offer words of encouragement. You can say something like, go on, tell me more, or I see. Don't feel like you need to fill every silence, of course. Allowing for quiet moments also allows the person to think about their feelings and what they'd like to say next. So it's okay if you don't know what to say. It's okay to let that silence just be. When appropriate, ask open-ended questions and find out more about the situation, or ask for clarification. You could say something like, could you tell me more about that? You can also reflect back. Repeating the words or phrases that the person uses can encourage them to go on and expand on their thoughts. And again, we don't expect you to do all of these. It's not like a checklist. You have to go through each one. These are just different strategies that you can use as appropriate, as needed. Summarizing is another thing that you can do. It signals that you not only heard what the person said, but understood the situation. And when the person is done speaking, go ahead and react, right? We're not made of stone. Respond in a kind and patient way, but avoid trying to fix the situation. Don't try to resolve the situation. Instead, offer your support. And that can be anything like just saying, what can I do to help? Would it be helpful if I refer you to this program? And again, you might not be the right person to offer that support. So letting them know by saying, would you like me to connect you to someone who can better support you with this? And again, ultimately, when offering your support, you want to offer some choice. Ask, don't assume you know what the person needs.
And a good segue from offering support and not trying to necessarily quote, fix the problem right away leads us into strategy number 6, which is empathy, offering support. This may sound obvious. I think most people prefer to be treated with empathy, but we really want to highlight it because it falls into both of those essential elements of a trauma-informed approach of creating a safe and supportive environment and fostering trusting and meaningful relationships. And so we're going to watch a video, a Dr. Brene Brown video around the difference between empathy and sympathy, so that we can really drive home that we're talking about empathy and support, not trying to fix it. So we'll watch that video now.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
And you heard some of the phrases there of it's about connection and building those relationships and responding in a non-judgmental way. And that really is important, as people who have experienced trauma may blame themselves, right? They may feel shame or fear, judgment, and rejection. So to counter those feelings and perceptions, it is especially important to demonstrate empathy.
So strategy number 7 is taking a strengths-based approach. For most people, encouragement and building upon one's strengths is a far more effective strategy than pointing out where they went wrong or where they fell short. This is especially true for those who have experienced trauma. And this might look a little small there. Again, you'll be receiving a copy of the slides, so no worries. A strengths-based approach, also known as an asset-based approach, it emphasizes a person's self-determination and ability to build upon their individual strengths, as well as the strengths of their communities and their social networks. So it acknowledges and considers the past, but makes a concerted effort to find what went right rather than only focusing on what went wrong. For example, instead of approaching your work with the primary point of view that the participants in our program face difficult situations at home, like violence or substance abuse, you can reframe that to be the participants in our program have taken an important first step by coming here today and are going to build on that strength and courage. So why does this matter? Individuals who have experienced trauma, they may see themselves as bad or damaged, like Arya just said. Focusing on strengths counters that negative narrative by building up a person's confidence, resilience, and sense of self-accomplishment.
Strategy number 8 is partnership, and specifically to focus on partnership and minimize the power differential, whether it's real or perceived. We know that people are experts in their own lives and their own healing, but all too often, people are not consulted about their healing plans or their service plans, which can only re-traumatize or at least perpetuate some of the notions that they're not in control, that they're not good enough. And so we want to counter that by really focusing on a partnership. And so what this could look like is being mindful of something like body language and space, right? Don't have all of your staff sitting on one side of the table and a person sitting on the other side alone. That does not feel like partnership. Asking what a person needs and is not assuming that you know. Sometimes we know that the options are like, if there's two options and both aren't great, but still offering those options, and allowing the person to make the choice themselves. And a tough one for myself included is if you don't agree with the choice or that's not the choice you would have made, that doesn't matter. We're trying to support them in their choice and moving forward. So again, why this matters is that trauma can make a person feel as though they have no control over their own decisions, life, or future. So by partnering with the individual and honoring their choices, we can begin to restore their sense of autonomy and control over their own future.
Strategy number 9 is to offer predictability, to be reliable and consistent. This strategy speaks to the essential element of building a trusting and meaningful relationship. So some of the most common triggers for individuals experiencing trauma include isolation, loss of supportive relationships, and abrupt changes. For example, families living in emergency shelters are sometimes given less than 24 hours notice that they are being moved to a different shelter. Sometimes the move happens late at night without regard to schedules or plans of the family, like school, work, benefit appointments, etc. As another example, some children in the foster care system may be extremely untrusting of adults. We mentioned this example previously, because in their experience, the adults who are supposed to be there for them are not. Broken promises and unwanted or unexpected change become the norm. So in order to mitigate those types of triggers or negative feelings, we need to go out of our way to provide the opposite, to be reliable and consistent, even about the smallest of things. So things like keeping our appointments, following through on everything we say we'll do, talking through changes, letting people know about our vacations, when we're going to be out. All of this is important because providing predictability, reliability, and consistency, even with the small things, helps us counter that narrative that the world isn't safe and that people are inherently untrustworthy.
And I know we're at time, but if you all have 2 or 3 more minutes, we only have about 3 more slides. We're wrapping up here. So if you can, please do stay. If not, we will be sending all the materials out. So strategy number 10, our final strategy today, is around closing the relationship, being really mindful of how you are doing that. A lot of times after we as nonprofit providers have given the services or supports or referrals to an individual, it's natural for us to move on to the next person or the next case. But however, as we've mentioned throughout this session, the sudden separation from supportive relationships can be harmful and hurtful, especially for those who have experienced trauma. And so we want to let people know what's happening next. Again, this goes with a lot of the other things that we have, strategies we've discussed. But when you're closing it, letting them know. So it may look like something as, now that you've graduated high school, we won't be seeing each other on a regular basis. You're welcome to come back for our college support programs that are run by Adrian. Let's go meet him together today. Or starting in October, I'll be going on leave for 6 months. Diana will be taking over your case, and I'll make sure that the 3 of us meet together before I leave. So again, being really explicit on what's going to happen, when it's going to happen, and what the next steps are if you're transferring a case or closing it. To reiterate why this matters, feelings of abandonment, especially for young people, are often at the root of a traumatic experience. And so by taking steps to close a case or relationship with care, we're lessening the risk that the individual will be re-traumatized by a sudden loss of a supportive relationship.
All right, so we are at time. We covered a lot of information here today, so we'll just end with a few key takeaways. Again, a trauma-informed approach to service delivery involves thinking and responding differently to a person's reactions and behaviors. Trauma-informed service delivery aims to create safe and supportive environments and cultivate trusting and meaningful relationships. Trauma-informed practices can be used by anyone in any setting. And we will be sending out that resource, Trauma-Informed Service Delivery strategies and actions for working with individuals, where you'll have all of these examples available. So please do join us in October for the next 2 foundational webinars focused on restorative justice. We'll have one on October 13th, restorative justice as a trauma-informed practice, and October 20th, restorative practice in action, and that'll be a panel discussion. Thank you so much for joining us. We will be sending out a link after this with the post-session survey. Please do complete the survey. It really helps us. Thank you so much for joining, and we look forward to seeing you in October.
Thank you, everybody.
Thank you.